Hey, everyone. Thanks for joining us. We're here today with Eileen, the CEO and co-founder of Elsa Fertility. Thanks for joining us, Eileen.
Thanks for having me.
I'd love to hear more about what Elsa Fertility does. Can you tell me about it?
Sure. We are streamlining the fertility treatment process by using AI to automate clinical workflow.
That's really awesome. Can you talk to me a little bit about what the founding story was? Like, how did you and your co-founder decide that this was going to be the company that you're going to focus on?
Yeah. So a little bit about me. My background is in healthcare operations and finance and investing, and at one point was doing a lot of work into the fertility clinic space. And around the same time, I actually went through a treatment myself, and then realized that a lot of pain points I'm seeing as a patient should and can be solved by starting my own company. So then I left my job, went through this whole journey at Stanford to sort of iterate on the idea and find the right team. So that's when I met Eric, my co-founder, who's my now CTO. He was working on a healthcare startup of his own at the time, but was winding that down and started talking about the fertility process, and his family member was going through the same treatment. So it really resonated with both of us.
I'd love to hear about what that process was like to kind of validate the idea when you were at Stanford. What did you do to figure out, like, end up in the solution that you're currently at? And like, what kind of research did you guys do?
Um, Honestly, by the time I got there, a lot of research has been done just by doing it professionally in my last job. So it was really about building the right experiments and actually launching the product and seeing how users interact with it. So we actually was building a slightly different product at the time Eric and I met. We launched a product early last year, had a paid pilot, saw users interact with it, and decided to move away from that. So the philosophy on our team is just like build it, see it break or see it work, and then decide to keep it or not.
What gave you the idea that the path that you were taking needed to be changed? Like, what was kind of the input that you were getting from the users?
At one point, we were building a product to be used by a different physician type.
I
So
see.
right now, we're selling into IVF clinics. Initially, we were selling into OBGYNs.
I see.
And for people who don't understand, OBGYNs are, we think of them as women's health generalists. And then IVF specialists are double board certified specialists who, do fertility treatments only. And we're building a product to sell into primary and generalist physicians.
I see.
And just we saw how they were using the product and spoke to hundreds of them to get their thoughts on how likely it's going to get adopted, and realized it's just not the right path to go down.
I see. So tell me a little bit about the product as it is now. Like, who are the customers? Like, what does it do kind of practically?
Yeah, we sell to IVF clinics, and we automate everything that happens on the clinical side except for top of license physician work. So that includes the onboarding, the intake, marketing to consumers. We do some of the nursing triaging, we do the workup, we do assessment, data processing, everything that happens at a clinic except for what requires attention of a specialist.
And is the idea here that, like, what is unique about an IVF's like workflow that you guys are automating that maybe doesn't apply necessarily to like a primary care physician or something?
There's a lot of pre-work that goes into a treatment cycle.
I see.
So on average, from the first interaction, the first consultation, to actually going into the clinic to get your procedure done takes a month and a half to 2
Oh,
months.
wow. Yeah.
Because you need to sync a lot of things with your natural menstrual cycle. There's a lot of medication inventory and reconciliation. Many tactics need to be used on like patient education and onboarding in general.
Yeah.
And all of that can happen virtually.
I see. And then, so do like patients actually interact with your guys' product?
Yeah. So a
I
large
see.
part of our product is consumer facing.
That's cool. So for them, what does the experience mean? Is it that they're getting their care faster, that it's just less work for them? What does that look like if I'm a patient using your product?
It's all of the things you described. It's
I see.
faster, it's intuitive, it's easier. I mean, I think women's health and healthcare in general have gotten more attention recently, but historically you hear from investors that like fertility within women's health is saturated and a lot of money has gone into it. but a lot of money has gone into the B2B side, building up brick and mortars or building out software just to benefit the doctors or the network. And if you talk to a patient, actually their experience is still really bad. Like
Yeah.
end to end, it's painful, it's time consuming, it's complicated, it's expensive, and not really a lot has gone into changing how they feel and experience the treatment process.
Yep.
And the way that we build our product, it's a coordination heavy, front end heavy software that actually touches the patient's experience. So we want to change that, not just on the physician's end, but also how they interact with our platform.
That's awesome. So what's the vision of the company? 5 years from now, you've succeeded. Everything that you were planned to do is done. What does the company look like? What goals have you all achieved?
Ideally, we make it a lot easier for people to access care. Turn it into a modern experience, just like how the analogy I like to use is DoorDash, Uber, Airbnb, like a different delivery method for a good that should be something that everyone has.
That's awesome. So what are the big milestones over the next year that you want to hit to kind of prove that you're on path to hitting this overall goal?
We're already working with quite a number of clinics in the space, so we just want to do a good job, help them expand, help them see more patients.
Yeah. So tell me a little bit about that. Like, so what does the traction look like right now? How has the market responded to the current version of the product?
Surprisingly well, actually. And I
That's
say
great.
surprising because I've worked with doctors a lot in my previous jobs, and it's not always easy to sell into healthcare. I
Yeah.
think that the way that we package this as a completely clean, almost zero integration product, and we handle pretty much all the work upfront, makes a lot of sense to physicians. So we're live now in a handful of locations, including both small, like independent clinics, as well as network, large blue chip clinics. So yeah, it's been really good, and we've seen a very rapid adoption curve.
That's awesome. How much do you think it comes from the fact that you've had a lot of experience in this market? You've worked with doctors before. You kind of understand the ins and outs more than someone just new coming into the space. Has that affected your ability to kind of build this company?
It's a great question. Yes and no. I think there's a lot of work you can do to read up on stuff and to model things out, forecast, whatever, do research, and I think that's definitely helpful in ideating. But I would say since building and launching the company, what really helped is building the product and see how people use it. Not at all. A lot of things that we learned, I could not have predicted it
Yeah.
prior to seeing people use the product.
And what does that feedback look like? So you're in clinics, doctors are using it. Like, how are you all learning quickly that how they use it and how they don't use it? Do you sit with them? Do you shadow them? Do you watch how they use the product overall? Like, what does that feedback looks like?
That's a great question. It's very tight knit and constant because we have data points from the consumer facing front. We also own the coordination layer ourselves right now by employing some of the nurses in between to use our own product. And we have weekly touch points with the physicians.
Nice. That's
Does
very
that
cool.
answer your question?
Yeah, no, it's interesting because, as a person who's built a lot of software in kind of just regular B2B or consumer, it's always interesting to me when founders are working in a space that, is a little bit more specialized or regulated and stuff, which it's just new to me, right? So I was just curious. So, you all are, the product's working, you're growing, you want to capture the market. What's your pitch to candidates? Like, why is Elsa Fertility a great place to work?
Number one is if you actually want to make a difference. I think me, Eric, everyone on the team, the nursing team, the clinical team, engineering team, design team, probably have options out there for us to, work at big tech or big finance or big healthcare, whatever. And we quit our jobs to do this because we do believe in that it will change people's lives. And fertility is a very interesting space to think about that, right? Like literally it will change people's lives. So I think first and foremost, if you want to make a difference in some shape or form, whether it's in healthcare or in women's health or in fertility or just in like humanity in general, this is a very interesting space to start. And we're at a point where like technology can really lift a lot of the weight that doctors see on a day-to-day, with AI, with automation, with things that I'm sure my CTO can do a better job describing. But for us, the opportunities in that intersection of mission and now the technology maturity. So that's first and foremost. And I think second, like you can probably tell by like the way I describe how we build products, it's very much a combination of traditional healthcare and be careful and compliant how we approach things to ensure clinical outcome, high success rate. But we also have the tech company ethos where we want to build things and see how users interact with things. So things move very quickly. There's a lot of ownership. We're not afraid to take risks.
I'd love to dive into that. The idea, like one of the things that I'd love to learn about companies is how things go from kind of idea to production. So could you tell me a little bit about that and how that works at Elsa?
Like a very high level or service lines or both?
I think high level, and then maybe we can dive into specific things.
Yeah, let me think about how to answer that question. We talk to who we're selling to and who use the product to get their feedback on what's working for them and what's not, and iterate on that. Usually we have either a person who is a physician or experienced coordinator design some of the workflows, and that gets pushed to our design team. Then that gets pushed to our eng team, create a new product, we'll launch it and see how end users react to that and decide.
And you mentioned the compliance piece. Like, are there things that you all have to do that would be different if you worked at just a consumer tech company to make sure that you're compliant, make sure that you're managing privacy and stuff like that?
Yeah, telehealth laws.
I see. And does that change the process at all in terms of like design engineering, or is it, pretty straightforward?
It changed the process for me.
Tell me about that. How so?
Because I do a lot with the operations and legal side of things, and work with a number of physicians that help us run our telehealth entities. So everything that before it gets pushed out to the public, we have to make sure it's HIPAA compliant. It's not in violation of any of the state or federal laws. So a lot of communication on my end to make sure that happens.
That's cool.
Yeah.
Talk to me a little bit about the team. Like, I heard about your co-founder, but like broadly, who else works there? I'm really interested in this idea that you have what you call healthcare specialists on staff too.
Yeah, we are eng and clinical heavy team. So Eric, my CTO, I'm not sure if I told you his background at all in this call. No.
You mentioned something about Wharton, but I'd love to hear more about him too.
Yeah, no, he did not go to Wharton. He went to Stanford.
Stanford. I'm sorry.
His partner
went to Wharton. Great.
Went to Wharton. He went to Stanford. He was computer science there, and then he was at Snapchat and Facebook for a number of years. I'm sure he can give you more on his own background. And then he actually left because he wanted to do something meaningful in the healthcare space to build his own startup. So he is a second-time founder. And so that's Eric. And then we have a few engineers working underneath him or with him. On the clinical side, we have licensed nurses who used to work at Stanford Hospital, Spring Fertility, VA, so with the government's fertility division, to help us sort of level set the right clinical workflow and protocols. We also are now building out our marketing team, which is important because this is a patient-facing, consumer-centric product. Starting to onboard a CMO who used to be or still is at a public company. Actually, we're hoping that once we raise seed, we'll hire him full-time, and a number of designers and agencies that I can go into detail.
So I love to hear a little bit about how you all work. And one way I've heard company culture defined is kind of the behaviors that your team rewards and the behaviors your team punishes. Or another way, especially for company sizes companies of your size that are smaller, it usually kind of like your company usually takes on the personality of the founders in some way. So, in that framing, how do you think about your company culture, or are there things about your culture that you guys are trying to focus on?
Scary thought if everyone ends up like me.
Yeah. I mean, the good and bad, right? There's going to be awesome things, but then they take on some of your other side too, which it's always interesting.
I think the things that you probably hear over and over again in the startup world are also true for us. Autonomy is a big thing that we reward, being able to take something that's a little bit more ambiguous and run with it, for sure. And we're at a stage of the startup journey where we're still relatively early, so a lot of things sometimes move in parallel. I think the ability to multitask and sort of draw pattern recognition between the parallel work streams is also pretty important. Let me think what else. general empathy, like humor, because just as human beings,
Yeah.
I want better
Yeah.
how to something who's funny and,
Yeah.
and laugh, you know.
Yeah.
What else? Any prompts you want me to answer? Culture is such a broad topic, honestly, man.
Yeah. So I've talked to a number of founders that all have kind of different ideas on how they want to build their teams, how work gets done. And some have very
Mm.
strong opinions of like,
Mm.
this is the type of person that we need. This is the type of way we want to work. Others are, will that'll kind of come naturally as we add more people to the team. And so do you have like strong opinions on, how your company will work the most efficiently? Like what will get done, like how projects will get done well beyond just who you're going to hire?
I don't micromanage.
Yeah.
I think that's a big thing. So maybe one thing that's unique about our culture is there's not really set working hours, and we define the task to be done and project to be completed, but not when and how you do it.
Yeah.
But I think that also comes with the responsibility of knowing how to handle this unknown.
Yeah.
That makes sense?
It does. I mean, one of the other things that's interesting about your company is it's so kind of mission focused. And I'm assuming that a lot of people join because of the mission, right? Like, as you mentioned, they have a lot of opportunities. Does that affect the way you all work in any way? Does that change kind of the motivation that people have on the team or the way you think about timelines or anything?
Actually, that's a great question. A lot of times we build based on a patient's needs.
Yeah.
And it's interesting in fertility because each stage of the patient journey can take a long time. We hear a lot from the clinical team and nurses and take their feedback into consideration when building out a product. And that almost always happens in real time. Like,
Yeah.
I don't think we've ever built something without having somebody going through it at the same time.
Yeah. Well, it's
like a sense of urgency.
Yeah.
Sense of things need to get done. Sense of whatever I'm doing is literally going to impact this person's medication inventory the next day.
Right.
How can I receive the lab orders? What blood tests are they going to get the next morning? Like, things are real, and things are real the next day.
Yeah. Yeah, it's wild because I know a lot of people that have gone through the process and it is quite taxing, the whole time, right? And, there's so many emotions and so much anxiety. Will it work? Will it not? And that's got to feel like a lot of pressure for you all, right? Like, we're at a really important juncture in someone's life. How do you all deal with that kind of pressure? Do you feel it deeply? I feel it for you a little bit.
Oh, yeah.
Yeah. Yeah.
And yes or no question, or do you want me to expand on?
Just expand on. Yeah, I'd love to hear a little bit more of that. Yeah, what does that look like for you all internally?
It's a lot of I think there's two things, and it comes with building anything in healthcare. There's always extra layer of caution that goes into launching a product or building a new thing, because like you said, fertility, cardiology, oncology, anything that touches a real patient, a medical issue, is going to be heavy. And therefore, we almost have to deal with two forces in play. The clinical teams always want to do something that's evidence-based, think a little bit more, be more cautious about what to launch and how to interact with real users. And we have to deal with the reality that this is a tech company also, and we have an eng team and a product team that want to build and get feedback quickly. I'm not sure if that gets to your question of how we feel, but I think as the CEO and as the CTO, our job is almost constantly balancing those two forces. Like, sure. What is the draw of taking the right risk to get feedback on a product, but also not compromising patient care? So we do that, for instance, like by starting off with more of the not simple, but a little bit more straightforward cases like egg freezing, instead of starting off with a highly complicated IVF patient, and peeled the layer of the onion to progress.
That makes a lot of sense. When you think about hiring, like you mentioned autonomy as a big thing, are there other things that predict success for the candidates that you've kind of interviewed that ultimately joined the company?
Give me some examples.
I think autonomy is a great one, or urgency, or mission focus. Like, are there things that are like, oh yeah, like that's a great predictor of someone's going to do well here?
All of those. I think communication skills is pretty important because we work across different time zones.
Yep.
I think that's one thing to highlight, is that we We are a remote first organization. We started off by me and Eric on opposite side of the coast, or opposite coast. A lot of the infrastructure is built and habits are built around working remotely, although we actually do prefer hiring in person.
And where are you all based right now?
New York.
Okay.
Yeah. But regardless, our clinical team is spread out between Arkansas, California, somewhere else, and we work in time zones. So being able to communicate both verbally and written communications is really important.
And then do like engineers and the clinical team like work together, or are there like a product manager in between or something?
Yeah, they work together.
So I'm assuming like being able to kind of almost have direct access to the clinical team and being able to communicate kind of and being empathetic to their problems is also pretty important.
I think actually that's one important thing is in the onboarding process of anybody joining the organization, there is a learning curve just to get to know the clinical process of how a patient goes through treatment.
That makes sense. Yeah. So talk to me a little bit about like what's next. Like what are the things that you're most excited about this year?
Ramping up our marketing efforts, which then we'll get more end user feedback on building the front end of the product, and building out more service lines. Right now we do mostly preservation. We want to venture into IVF cycles and maybe even donor cycles and surrogacy. Also within functions, developing even more automation. So right now we do a lot of onboarding, the data processing, but building out, what we're doing right now is building out an AI agent to handle the edge cases as the patient flow through those entire.
That's really cool. So you've now been on this journey for a little bit, being a founder. You've tell me a little bit, like, are there things that you've learned that you wish you knew earlier, or things that are maybe counterintuitive that you've like learned building a company, or maybe surprising?
I don't like that question.
Well, I think one interesting.
Everything is surprising.
Fair, okay.
Everything is surprising. Nothing we did is actually something that I thought we would do.
Yeah.
Different product that we started with upfront. I think maybe what's surprising is how non-transferable our past work experience are. Let me think. Maybe like as a CEO, managing teams as they grow across, sizes was a learning curve for me personally. Like working with just 3 people, very different than working with 7, and now I'm sure we're going to be working with more people.
How have you like been able to kind of make sure that you're leveling up for that and kind of keeping the right mentality for the stage, right? Like maybe like, making sure that you're working in the way that you should at a 7-person company versus a 3-person company. Do you do anything special? Have you had to kind of change your philosophy in some ways for that?
A lot of feedback.
Okay.
A lot of feedback between me and Eric. We have scheduled feedback sessions weekly and bi-weekly. We do team feedback sessions, like within function teams, clinical feedback, and then engineering catch up product. And then we're trying to, now that we've larger, have a group session that's a combination of happy hour and like demo day so that everyone knows what's going on. I think that's definitely the risk of scaling too quickly is you lose sight of what's happening within each pod.
Yeah.
And that's right. So we've had to really adapt.
And is there things that you all have done like rituals wise to make sure that, the remote company is staying fairly cohesive, that people are aware of things happening, that you guys are maintaining a good culture?
We post about, whenever a new member joins, we have them introduce themselves, post about their accomplishments, a new product feature is shipped, again, celebrate some of the small wins. That's one thing. And I think number 2 is being a little bit vulnerable about what's going on behind the scenes. Like, we are moving away from this product because XY things didn't work out. And, I appreciate your effort on that, but we're moving this for this reason. I think balancing between transparency and efficiency is something that I had to learn.
I think it's always tough because it's like you want everybody to know what's going on, but also you want to make them that they're motivated, they're excited, and they're persevering through. Yeah, it's always a struggle, I think. I don't think it gets
sometimes you don't even know what the right answer is.
Yeah, exactly. Yeah.
If I did, I would be, team cook.
Exactly.
Let's be on this call.
Yeah.
3 to a PM.
Yeah, exactly. Thank you so much, Eileen. It's been really awesome hearing more about Elsa. If people want to learn more about the company, where should they go?
We have a website, elsafertility.com. Feel free to also email me, Eileen at elsafertility.com.
Awesome. Thanks.